work with us to echo these messages, to make our state vibrant for the future, to win the post-COVID decade. And it's not just about lowering the corporate tax rate.
Tonight, the CEO of one of Indiana's top companies taking aim at state's leaders, saying Indiana is behind the curve.
The head of Eli Lilly and Company says the state needs to stop bragging about its low cost of living, business-friendly climate, and transportation network and focus on where Indiana falls short. David Ricks gave that message to the Economic Club of Indiana. He highlights 3 liabilities where Indiana is not thriving: education, health, and workforce. We have team coverage tonight hitting every part of his speech. First up, I-Team 8's Richard Essex.
The health of our citizens and the education level of our citizens in what will increasingly be an economy driven by ideas, not just by putting things together.
As the CEO and chairman of one of the largest employers in the state, his comments are taken seriously. David Ricks says Indiana is not up to the challenge of the new economy. He cites national data that shows Indiana does well in the cost of living, cost of doing business, and business climate. However, our liabilities, he says, are dragging us down.
Our education attainment in the state is not good. The ability to reskill the workforce, I think, could improve. Health, life, and inclusion overall, I think conditions rank poorly nationally in our state. And then workforce preparedness, also related to reskilling, is a liability for us.
Rick says close to a third of traditional jobs will be replaced in the next decade in favor of math and science-heavy positions. He says this is critical to Lilly's core business. According to his data, only a third of Indiana high school students pass the state standardized math test, and only 20% go on to earn a bachelor's degree.
Hoosiers today have relatively low performance on national metrics of education.
Quality of life, or quality of the healthy workforce, is another one of his concerns. He says Indiana's healthcare costs are too high, higher than surrounding states, and too many people are using the available resources, which he says doesn't make Indiana attractive to potential employers.
Who funds this? Companies fund this. And we need to address this to attract more industry to our neighborhood here.
And he says we must include everyone.
Certainly outcomes on all these dimensions for black and brown communities in Indiana are worse, and we should do something to affect that. And one of the primary things businesses can do is offer good employment.
I asked Kyle Anderson, the Indiana University Kelley School of Business, if Rick's concerns were valid. He says when Amazon was looking for a second headquarters, Indianapolis was on the list, but they passed.
It's not clear that that was directly related to any single issue, but we know that big headquarter projects have not been here, largely because of availability of the skilled workforce.
The company has not made any moves that would indicate that they are considering moving the headquarters out of Indianapolis, but in the past 2 years, they've invested billions in manufacturing and research facilities in North Carolina, Boston, and in Ireland. In downtown Indianapolis, Richard Essex, Wish TV, WishTV.com, and follow us on Facebook.
Thank you, Richard. Let's continue our team coverage with News 8 government reporter Garrett Bergquist. Garrett, you spent today talking to the people who write the policies and budgets that Lilly CEO criticized.
Yeah, Rick's comments ultimately criticize the decisions that are made in the building behind me. As you can expect, reaction falls along party lines.
We've been talking about this for several years now, the lack of investment that we've seen in education and healthcare. Companies that we would love to see either locate in Indiana or expand in Indiana are now going to other states like North Carolina and Massachusetts.
House Minority Leader Phil Giaquinta blames the Republicans who have controlled both chambers of the General Assembly since 2011. He says large employers want a well-educated workforce. They also want to go places that offer a good quality of life for their employees. That means good schools.
Frankly, when we have the sessions like we did this past session and continue to have these sessions that are going to focus on sort of these cultural war issues, that doesn't help us attract businesses to the state either.
Republican leaders say they're working on the very issues Rick's raised. House Speaker Todd Houston tells me in a statement, "We're continuously looking for ways to make our state a better place, including skilling up our workforce, lowering health care costs, improving educational outcomes, and diversifying state energy policy." And Senate President Pro Tem Roderick Bray says Senate Republicans agree lowering the high costs of health care in Indiana is critical, which is why we've taken steps to provide price transparency and push industry leaders for action on this important issue. We also place a high priority on education and are committed to continuing to advance our state's education system so it works well for all Hoosiers. Governor Eric Holcomb says there's still more work to be done, but he says the state's policies still bring in new business. He helped cut the ribbon on Intellinair's new headquarters near Meridian Hills Thursday afternoon.
In the K through 12 pipeline, we got to make sure there's fewer leaks in that pipeline, and then through higher education as well, certificates, credentials, degrees, etc. We have the right ecosystem. We just talked about, we're way ahead of where we've ever been in terms of jobs over the last 5 years.
The governor pointed to other jobs announcements when I asked him about Rick's comments. For example, New Jersey-based pharmaceutical company Catalent this morning announced that it will add more than 1,000 new jobs to its Bloomington facility. Live at the State House, Garrett Bergquist, Wish TV, wishtv.com, and follow us on Facebook.
Garrett, thank you. Let's go ahead and continue our team coverage with News 8's multicultural reporter Katira Winfrey. Katira, Dave Ricks also says that Indiana falls short when it comes to the inclusion of minorities as well as those who immigrated here.
Yeah, and I got a chance to talk to a man who specializes in diversity, equity, and inclusion. So Michael Twyman of In Excelsis Consulting, he says it's hard to say if Indiana falls short because we don't have the data showing where we started. What we can do is compare ourselves to other communities or states. He says the consulting work he does centers on diversity, equity, inclusion, but has a special emphasis on racial equity. He says advancing DEI work also often depends on the local political environment. While it may seem like there's been a rush the last year to expand DEI work following George Floyd's death, he says some companies have a history of implementing DEI measures 20 to 25 years ago. Alongside the countless smaller agencies implementing that work, it may be more widely noticed when you see equity policies added to places like the governor's office, the police department, or even sports teams.
It's not just good enough to make a statement. It's not just good enough to have more people of color within your organization or to have a diversity, equity, and inclusion officer and say our work is done here. It really is about mobilizing resources, sustaining the work over time, and really being able to evidence that you're committed beyond just statements.
And you may remember Lilly in 2020 held its Day of Solidarity, We Stand Together. The event shined a light on inequalities impacting minority and black communities, but also they partnered with groups and people to find solutions. Now, Ricks added that wanting a diverse talent pool also plays a role in site selection for them. Reporting in the studio, I'm Wish TV News 8's multicultural reporter, Katira Winfrey.
Thank you, Katira. Let's turn to another part of that Rick's speech, lack of affordable health care for all in Indiana. I want to bring in News 8 medical reporter Dr. Mary Gillis. You've been covering this issue for a while now, and you had a chance to talk to one Hoosier on a mission to change it.
Right. So thanks, Cody. A lack of access and equity in healthcare isn't a new issue. It's been around for decades, but it's taken on new urgency after 2 years of the COVID-19 pandemic.
For years, the costs of health care have been soaring, making regular treatment nearly impossible for many groups. Tony Gillespie is vice president for public policy and engagement with the Indiana Minority Health Coalition. He knows how difficult it can be for minorities to get even the most basic of medical care.
I think a big challenge that Indiana faces is that as a state, we don't invest in health care. The majority of the resources are federal. And that's something that's been an issue for a while. And until that begins to change, we're going to find ourselves in the same places.
Lack of preventative care for chronic issues like high blood pressure, heart disease, and diabetes leads to missed time at work, which Gillespie says leads to trouble getting and keeping a job. Geography can also be a major factor. People living in rural areas of the state can have limited options, which makes for another barrier to annual checkups and treatments.
Really, we're going to have to move in concert as a state. It will never happen with just one or two agencies trying to address it. And that's where the policy piece comes in, and policymakers and legislators or CEOs of companies like Lilly.
Lilly has also been the target of critics about the high cost of health care, specifically the cost of insulin for families dealing with diabetes. In fact, a Senate investigation found insulin manufacturers, including Lilly, aggressively raised the price of the insulin without significant improvements to the medicine. Reporting from the newsroom, I'm Wish TV's medical reporter, Dr. Mary Gillis.